It's a Northwest News Radio weekend. Now, back to IRG's Health Talk.
Our next guest here on IRG Physical and Hand Therapy's Health Talk is Virtaj Singh, a board-certified physiatrist with subspecialties in pain medicine at Seattle Spine and Sports Medicine, talking about radiculopathy, its symptoms and treatments and return to activity. Before we talk about the symptoms, let's talk about what it is, Shannon.
Yeah, Tom, that's a great question. Radiculopathy is when you have an irritation to a nerve and you get referred pain into your extremities. Radiculopathy is really painful, uncomfortable, and it kind of decreases a patient's ability to be functional. And Dr. Singh is board certified, and that's what his focus is taking care of the spine. He is a physiatrist. We've talked to physiatrists in the past. I always call them the detectives in the musculoskeletal world. So we're going to chat with Dr. Singh.
All right, here's Detective Singh and Shannon O'Kelly.
Dr. Singh, how are you?
I'm doing well. How are you?
Thank you again for joining us, Health Talk. You've come on before. I'm very interested in what you do in your practice as a physiatrist. Kind of a complicated area you work in, pain management, the spine. We all know that's complicated. Tell our listeners a little bit about your practice and kind of the day-to-day operations in your practice.
Yeah, so I practice at Seattle Spine and Sports Medicine. I'm a physiatrist. Basically, it's a mix of non-surgical orthopedics and neurology. We really are kind of the experts on injury, any number of injuries, especially my big focus is mostly on spinal injuries. But yeah, we do a variety of things here.
Yeah, I've always equated physiatrists to the kind of the detectives of this musculoskeletal condition, particularly in the spine, which, as I mentioned before, is very complicated. You have a lot of things in your toolbox, so to speak. How did you become interested in this area of medicine?
Yeah, I mean, I was always interested in sort of understanding how injuries affected the body, the musculoskeletal system, but I also enjoyed the neurological systems, both being able to diagnose, but also treat. It's one thing to be able to sort of help somebody figure out what's going on. It's another thing to be able to give them some relief for it. And I've really enjoyed being able to use various types of injections to pinpoint where somebody's pain is coming from, because it's not always clear cut. And you could have different areas that might be causing somebody's pain. One of the ways we can be more certain about that is to anesthetize the area or just numb up the nerve to that area and see if your pain goes away.
Yeah.
Once we've pinpointed where your pain is coming from, then we can design a rehabilitation program and offer other interventions that might help further improve your situation.
Yeah. When you talk about rehabilitation program, maybe you can address, I know you like to collaborate with several practitioners. That's a big focus. Collaboration is key to kind of getting patients better, particularly when you talk about the spine. Maybe talk about how you collaborate with the practitioners.
It's one thing to identify what's causing somebody's symptoms. It's another thing to figure out what factors led to that problem. And that really requires me to work in collaboration with physical therapists, occupational therapists, chiropractors, other skilled therapists who can help you figure out what were the biomechanical factors that led to somebody developing this symptom. You can figure out the what, but if you don't figure out the why, you're only getting half the equation.
Yeah, good point. Okay, our topic today is this word we call radiculopathy. And maybe you can start by defining what radiculopathy is, and we can kind of get into the causes and the symptoms and the treatment. What is radiculopathy?
Yeah, the idea of a radiculopathy is something within your spine pinches one of the nerves that it's either going down your arm or your leg. Some people call it sciatica when it goes down the legs, but you get these symptoms that can come from a variety of different reasons. It's not always a radiculopathy. So that requires further investigation, a good clinical examination, higher level imaging, perhaps an MRI. Sometimes you can do nerve testing, but ultimately you're trying to figure out, is this coming from the spinal canal, some nerve being pinched? And if so, which nerve, and what do you do about it?
So, I mean, the mechanism of pinching a nerve or compressing a nerve is radiculopathy. The symptoms, just to kind of define this, the symptoms that maybe people experience in their limbs, you describe sciatica. A lot of people with sciatica have symptoms that radiate down. Would that be called a paresthesia? Let's just kind of define radiculopathy versus paresthesia.
Yeah, I mean, a paresthesia is a symptom, and the radiculopathy would potentially be the cause of that symptom. What a paresthesia is like a patch of numbness. And sometimes that's how a radiculopathy presents. Radiculopathies down an arm or a leg can present as it's just painful down that extremity, or it could be numbness. It could be numbness in a very specific distribution down either your arm or your leg, or in a worst case, it could be weakness. You can start to develop weakness in your leg, weakness in your arms, and they can come in combination too. Any of those can be a sign that you have a radiculopathy.
Back with more from Virtaj Singh and Shannon O'Kelly after this time out on Northwest News Radio.
It's a Northwest News Radio weekend. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
We continue with IRG Physical and Hand Therapies Health Talk, and we continue with our conversation with Virtaj Singh and Shannon O'Kelly.
Dr. Singh again talking about radiculopathy, which Dr. Singh described as some kind of compression in a nerve root or maybe on the spinal cord that results in some symptoms and some pain. How common is it, and what is the most common condition that causes radiculopathy in your practice?
Yeah, I mean, radiculopathies are common. I mean, some form of back pain or neck pain is inevitable in life. I mean, and if it starts to go down the arm or leg, that's when it becomes a little bit more concerning. It's a very common condition. It's probably one of the most common conditions I see in my practice.
What is the most common treatment of this radiculopathy?
Well, that's the thing. I mean, in some people, it is self-resolving. Given enough time, it can get better. Also is oftentimes aided by physical therapy. Mm-hmm. Sometimes it is so painful, you have to calm down the inflammation and pain that's causing the nerve. That's where we may consider injection therapies to try and calm down that inflammation, get that nerve to quiet down so that you can rehabilitate. There are circumstances in which you might have to have surgery for it. The key is to kind of triage between all of that. You know, is this surgical? Is this a situation where it's going to get better with time? And really, you know, there's so many particularities. It has to do with the extent that the disc might be herniating out. If there's a bone spur, you know, you have to take that into account because that changes sort of the equation. Really, the devil's in the details. You have to get imaging. You have to do a good clinical examination to really triage, hey, is this one of those that looks like it's going to turn a corner pretty quickly? Or is it one of those that's going to linger and cause possible nerve pain, possible permanent weakness, et cetera, because you treat those very differently.
And one of the interesting things that you're using technique-wise is you can use guided injections now in today's world. Probably been around a little while, but maybe talk about ultrasound, fluoroscopy, some of the techniques that you have to really be accurate if you do have to inject that area with some kind of anti-inflammatory medication.
Okay, so for instance, let's say you have some sciatica symptoms going down like your right leg, and you get an MRI and it shows a little bit of a protrusion. You're not quite sure if that's what's causing the pain. Maybe it's the SI joint. You really have to do good clinical examinations. But for me, the way to really pinpoint it is to anesthetize the nerve root and see if your pain goes away. Mm-hmm. So you can basically put a strong anti-inflammatory and a strong numbing medicine right around that nerve. And it's one of the most gratifying things. Somebody comes in with this debilitating sciatica pain and they walk out and they're like, oh my God, I feel normal again. For me, that diagnostic value is key because if I numb up that nerve root and your pain goes away, now I've pinpointed where your pain is coming from and we don't have that ambiguity. One of my goals in life is to help people prevent from doing unnecessary surgery. Yeah. If you see a surgeon too soon and they think something's what's causing your pain, but we really don't know for sure, and you operate on it and you don't feel any better, that's a big loss. If you're doing physical therapy and I can calm that nerve root down and I can say this is the nerve root that's coming down, I can offer that information to a skilled physical therapist who can help you recover from it more quickly.
Good stuff. We are out of time, but everything you need to know about radiculopathy is right there. So let's have you back on in the future. I'd like to continue to have conversations about some of the techniques to treat complex spinal conditions. Great work. Thank you for joining us.
Thank you.
You've been listening to Virtaj Singh, a board-certified physiatrist with a subspecialty in pain medicine at Seattle Spine and Sports Medicine, and you can get more information at seattlespine.com. Shannon, this is something I had not heard of, radiculopathy, but as you mentioned, you call guys that are board-certified as kind of the detectives of finding these issues, and sounds like he knows what he's doing.
Oh, absolutely. I mean, if you've ever experienced any kind of back pain, radiculopathy, paresthesias, just pain in the neck or back, Dr. Singh is an excellent resource to investigate and find out what the root of the problem is, and then, more importantly, to provide some type of treatment or intervention with good results, particularly in today's world of minimally invasive surgeries and techniques.
All right. Well, we'll be back with our final segment after this time out on Northwest News Radio.